previous video we have discussed about the nursing diagnosis part 1, so we'll be completing the nursing diagnosis in this particular video. So today I have come up with the part 2 of the nursing diagnosis. Let's go through this. Hope you will understand. So let us start now. Let us now discuss about the components of nursing diagnosis. So nursing diagnosis has mainly three components: problem and its definition, etiology, and defining characteristics. So let us discuss them one by one. The first component of the nursing diagnosis is problem and it is definition. It is also called as diagnostic label. The problem statement, it describes client's health problem or response for which nursing therapy is given. इसका मतलब ये होता है कि जो हमारी नर्सिंग डायग्नोसिस स्टेटमेंट का पहला पार्ट होता है उसको हम डायग्नोस्टिक लेबल या फिर प्रॉब्लम बोलते हैं, और ये वो वाली प्रॉब्लम होती है जो क्लाइंट में प्रेजेंट होती है और जिसके रिगार्डिंग हम केयर कर रहे हैं पेशेंट का. बट जो भी हम डायग्नोस्टिक लेबल सिलेक्ट करेंगे इट शुड बी अप्रूव्ड बाय नंदा एंड इट शुड क्लियरिफाई द मीनिंग. फॉर एग्जांपल वी कैन से ब्रीदिंग पैटर्न or circulatory function. But since breathing pattern gives the incomplete meaning, we cannot understand whether a patient's breathing pattern is regular or whether it is irregular. Since breathing pattern will define problem and we can say it is a diagnostic label, but we should add some qualifier which will clarify its meaning. So these qualifiers are the words that have been added to some of the Nanda labels to give additional meaning to the diagnostic statement. For example, while explaining a problem like breathing pattern, we have to add a qualifier like impaired breathing pattern or impaired circulatory function. But it is not always needed to add qualifier to every problem, but in certain situations we have to add some qualifiers to the problem so that it will give us a clear cut meaning about the patient's problem. The second part of the nursing diagnosis statement comprises of etiology. Etiology, as everybody knows, is actually the cause of the problem, or you can say the related factors or risk factors associated with the first part, which is the problem. So etiology, it identifies one or more probable causes of the health problem. It gives direction to the required nursing therapy and it will enable the nurses to individualize it client care. Let me explain this. For example, we have a problem or diagnostic label like constipation. So we have three patients with the same problem, which is constipation. But whenever it comes to the problem or diagnostic label, all the three patients have the same diagnostic label, which is constipation. But when we explain its etiology, the causes may vary. One patient is having constipation because of long term laxative use. Another patient is having the constipation where the cause is low fluid intake. And a third one is having the constipation because of high protein or you can say the low fiber diet. So here the patient who is using the long term laxatives, its management will totally vary. The person where the cause is low fluid intake, so he will be managed by giving the extra fluids. The one where the patient has taken the low fiber diet, its management will be giving the high fiber diet to the patient. So etiology or the second part of the nursing diagnosis clarifies the cause of the problem, and after knowing the cause, nurse is able to provide individualized client care depending upon the cause of the problem, and it will help her to manage a patient accurately and appropriately, and so it will give direction to the required nursing therapy. So another example we can say anxiety. Since anxiety, we say the patient we have patients with anxiety, but in every patient the cause vary. Some may have anxiety due to disease condition, so he will be managed accordingly. Some may be having anxiety due to family issues. Some may be having because of fear of surgery. So every patient will have the different etiology for the same problem. And after knowing the etiology, we can provide the individualized patient care to the respective patients. So this is how the etiology part or the second component of the nursing diagnosis is equally important to understand what kind of care a patient needs. The third and the last component of the nursing process is defining characteristics. So these may include the signs and symptoms. So the cluster of signs and symptoms that indicate the presence of a particular diagnostic label. For example, uh, fever, stiffness, headache, confusion, increased sensitivity to light, nausea, and vomiting. But since already explained in the previous lectures that we have five types of diagnosis, in which the first two can be the actual or the potential. And the actual is one where the client signs and symptoms are present. And in case of risk or potential diagnosis, we don't have any subjective sign regarding the patients. So we cannot add defining characteristics to the problem statement of a patient having the risk diagnosis, but we can definitely add defining characteristic part to the nursing care plan, or we can say the nursing diagnosis of a patient with having the actual diagnosis. So let us now discuss about the diagnostic process. It mainly consists of three steps, that is synthesis, analysis, and critical thinking. Synthesis part comes in the assessment phase where you collect the data using different sources either by subjective or objective ways, or some other ways you can use to collect the data, or from the primary sources or from the secondary sources. But all the data gathered results in the synthesis of some information regarding the patient which will help you in framing the diagnosis. After that, the data collected is analyzed properly for its completeness, for its accuracy, and is cross checked. And then analysis is done. And finally, the third step will be the critical thinking. So, all that data which has been generated, which has been analyzed, and finally, critical thinking process is done to actually prioritize the needs of the patient as per his condition. Let us now discuss about the steps of diagnostic process. So, diagnostic process, once you are now ready to frame a diagnosis regarding a patient, so in that way, there are the three main steps which include analyzing the data, which has already been collected by you by health assessment, by interviewing, by observing, by using these techniques. So you have collected the data, now you are analyzing that data. After you have analyzed the data, you are identifying the patient's health problems as well as risks and also the strengths which are present in the patient. Then finally you formulate a diagnostic statement about a patient. And the first step which I said is the analyzing of the data. How it is done? Data analysis, it involves number one is comparing data against standards, cluster cues, and identification of gaps, and then consistency. Comparing data against standards. For example, your patient is saying that I am having the fever, but what you actually did, you checked the patient's temperature to clarify how much temperature patient is having. Is he really febrile or not? And then grading the type of fever, whether the patient is having low grade or high grade fever. Then the cluster cues. Accordingly, once you have compared the data against the standards, then you finally make some cues that why this condition is in this particular patient, what may be the cause, and accordingly, further you identify the gaps and inconsistency. If a patient is saying that I am having very high temperature, I am not feeling well, and after checking the temperature, your patient's temperature is not too high. So, in that way, you have to identify the gap or inconsistency. You may again have to recheck the patient's temperature to clarify whether your recording is accurate or not. This comes under the analysis step, which is the first part of the diagnostic statement. Then the second part comes identifying the health problem. After you have properly analyzed the data, the nurse and the client they can together identify the patient's strengths and the problems. And this step is called the primary decision making process. So, by after properly analyzing the data, you come to some conclusion regarding the patient's health condition or making some diagnostic statements about the patient. So that's why we say this is a primary decision making process. Then the third step is formulating diagnostic statement. You have analyzed the data, you have identified the patient's problem, now you are actually formulating the diagnostic statement. So diagnostic statement can be one part statement, it can be two part statement, it can be three part statement. Let us discuss these one, two and three part one by one. So we will first discuss about the one part diagnostic statement. As earlier explained, I already said that every nursing diagnosis should have three components. But sometimes we have some diagnoses which only contain one part or one component, which is the diagnostic label. So one part diagnostic statement is the one where the diagnostic label or problem they are defined and they tend to become more specific, and the intervention they can be derived from the label itself. And here the etiology may not be needed. So for example, syndrome and wellness diagnosis they consist of label only, or you can say the nanda label only. For example, rape trauma syndrome, or we can say the spiritual well-being. Such kind of diagnoses are called one part diagnostic statement because we don't write the causes and the defining characteristics, we just write the nanda label only, or we can say the problem only. After that comes the two-part diagnostic statement. So this is a basic kind of diagnostic statement and it consists of the two components or two parts. The one part will be the problem statement or the diagnostic label, which will define the statement of client response. Second part will be the etiology or contributing factor or probable causes of the responses. For example, once we say constipation, that will be the problem. When we say it is related to insufficient fluid intake, so we are saying the problem as well as the etiology. Or sometimes when we say acute pain defines the first part, which is the problem, and then related to surgical incision will be the etiology or the second part of the diagnostic statement. Or another example is insomnia related to hospitalization. Insomnia is the diagnostic label or the problem statement, and hospitalization will be the contributing factor or the cause, or you can say the etiology. So such kind of diagnostic statement where we use the problem statement as well as etiology, those are called two part diagnostic statements. You can also frame a kind of diagnosis which is called three-part nursing diagnosis. It's also called as PES format, and P stands for the problem, E for etiology, and S for the signs and symptoms or defining characteristics. And this is a kind of diagnosis which contain all the three components. And once we are making the actual diagnosis of a patient, so that can be documented by using three-part statement. And it cannot be used for risk diagnosis and or potential diagnosis. In that case, we can use two-part nursing diagnosis. So once we have a problem statement which or once we have a nursing diagnosis which contains all the three components, that is called three-part nursing diagnosis. So here are certain examples of three-part nursing diagnosis. For example, acute pain related to surgical incision as evidenced by verbalization. So here we can see the three parts: acute pain, surgical incision and verbalization. Acute pain is the problem, surgical incision will be the cause or etiology, and verbalization will be the defining characteristic. In a similar way, infective airway recurrence related to accumulation of pulmonary secretions as evidenced by crackle sounds on auscultation. Ineffective airway clearance is the problem. Accumulation of pulmonary secretion will be the cause or etiology, and then crackle sounds on auscultation will be the defining characteristic. Hyperthermia related to underlying infectious process as evidenced by a temperature of 100 degree Fahrenheit. So hyperthermia actually will be the problem. Underlying infectious process is the etiology, and the defining characteristic will be the temperature of 100 degree Fahrenheit. So these are some examples of the three-part nursing diagnosis, which contain all the components, which are the problem, etiology, and signs and symptoms or defining characteristics. But sometimes we may have certain variation of these basic formats, where we cannot use either the single part or one part or two part or three part. Uh, some of the variations are where you are writing the unknown etiology, or where you are using the phrase complex factors. Where you are writing the unknown etiology, they comprise non-compliance related to unknown etiology. Or using the phrase complex factors like chronic low self-esteem related to complex factors. Using the word possible to describe problem or etiology. For example, possible low self-esteem related to loss of job and rejection by family. Using secondary to divide the etiology into two parts, like for example, risk for impaired skin integrity related to decreased peripheral circulation, secondary to diabetes. Or adding second part to the general response or Nanda label to make it more precise. For example, impaired skin integrity, left lateral ankle, and related to decreased peripheral circulation. These are some of the variations to basic formats. So let's now discuss about some of the qualities of the diagnostic statements, which include, the first thing is that the format you are using is accurate. For example, for actual nursing diagnosis, you have to use three-part nursing diagnosis. For risk diagnosis or potential diagnosis, you can use two part. For syndrome diagnosis, you can use one part. So you have to choose the actual format. It should be accurate. The actual problem present in the patient. It should be concise. It should be neither too long, neither too short. It should be concise and meaningful. It should be specific related to the patient problem, and it should be descriptive. It should be such so that we can understand both the problem as well as the etiology and its defining characteristics. There are certain ways by which we can avoid certain errors which can occur in diagnostic reasoning. These are verify. So first thing is to verify. So you have to build a very good knowledge base and acquire clinical experience. You should have a working knowledge of what actually is normal. For example, if you are checking a patient's temperature and you can only say whether it is hyperthermia, normal body temperature, hypothermia, or something else, you can only say once you know the normal values. You have to consult resources, and you have to improve your critical thinking skills. By these ways, you can avoid errors in the diagnostic reasoning. Let us now see the difference between the nursing diagnosis and medical diagnosis. So let us first see the nursing diagnosis. Nursing diagnosis is always care focused, while as the medical diagnosis is mainly focused on the etiology. In case of nursing diagnosis, it identifies the risks and problems of the patient, but in case of medical diagnosis, it identifies specific clinical entity that is causing the illness. Nursing diagnosis is focused on signs and symptoms of the patient, whereas the medical diagnosis specifies the pathology. Nursing diagnosis focus on the person and their physiological or psychological responses to the illness, whereas the medical diagnosis focuses on the illness. So these are some of the differences between the two. So once we say nursing diagnosis is mainly focused on the care aspect of the patient. Let us see some examples of the nursing diagnosis and medical diagnosis as well as the collaborative problems. For example, in if a patient is having the medical diagnosis as pneumonia, the nursing diagnosis will be the ineffective airway clearance. If a patient is having a medical diagnosis of amputation, the nursing diagnosis can be the disturbed body image. If a patient is having a medical diagnosis of type 2 diabetes mellitus, and the nursing diagnosis for the same patient can be risk for unstable blood glucose. If a patient is having a medical diagnosis of post-op prostatectomy, and the nursing diagnosis may be the impaired urinary elimination. If a patient is having a cerebrovascular accident as a medical diagnosis, and for the same patient, nursing diagnosis will be the self-care deficit. And some of the collaborative problems may include potential complication of head injury, increased intracranial pressures, potential complications of myocardial infarction such as congestive heart failures. So these may include the collaborative problems, and so we can have both the nursing as well as the medical diagnosis. So you can frame more than one kind of diagnosis for one medical diagnosis. So you can frame more than one kind of nursing diagnosis for a single medical diagnosis. Let us see some of the example of different types of diagnosis. So first one will be the problem focused, like ineffective breathing pattern related to decreased lung expansion as evidenced by dyspnea, coughing or difficulty of breathing. Second will be the risk for ineffective airway clearance as evidenced by accumulation of secretions in the lungs. Third, which is the health promotion, which may be the readiness for enhanced family coping as evidenced by verbalization of desire to information that will enhance the health choices. Another is the syndrome like chronic pain syndrome. Another is the possible chronic low self-esteem. So these are some of the example of different types of nursing diagnosis. Hope you must have understood all these clearly. If you have any doubts, you can write me in the comment section below. So this was about the part 2 of the nursing diagnosis. So hope you have understood the different types of diagnosis, how to frame what are the various components. And if you like the video, do share and subscribe. And thank you for watching, and I hope now you are ready to plan care for your patients. Thank you so much.